a question, and there is no, I mean, I just as, a couple of things I want to respond to. This is a big gamble, isn't it? And we are paying for health care for everyone, one way or another. So, is this system going to work, or are we going to make a system that works out of this? Time will tell. We'll see. All right. We will see what needs to be done as time goes on. And there is a huge concern about who's going to care for all the newly insured patients. I'm hoping that there are some people who want to go to medical school. First, well, the second one, let me get to that first. There talks about people working into groups, which you practice, you're affiliated with the hospital. And even if you're in solo practice, you have relationships, even through the medical society or through where your patients are treated inpatient. And that would be one kind of arrangement that could be possible within. What was your first, what was it, give me a, then what was your first, what was it, give me a,
the low rate of insurance reimbursement, yes. Because that's why he has 5,000 patients, and that's why so many people are leaving
right.
town.
Because not only does Medicare reimburse, well, the private sector, private insurers follow Medicare reimbursement so, to a great degree. I want to say that I don't have a lot of answers to your questions because we will see, basically we have to see if it works. Now, to your first point about the quality review, and I'm not sure to what you're referring either, if it's something that's coming out of CMS. Now, the issue of illegal care, medical care, patient care for those who are here illegally, there's really, we need immigration reform. I mean, pure and simple. But this is an issue, and it's a cost. We can stipulate, which we have to the best of our ability, what we can pass into law, the protection so that only people who are here legally can access this kind of care. Now, how they get care for the sake of the health of everyone, other ways, that depends on the wider community and who's willing to care for them. Often there are places. We guys chose not to. I'm not sure either what was the rationale, but if it isn't working, then it can be changed. None of this is set in stone. Now, I hope in the legislation there are some incentives. That's what we should do.
Health insurance. Would you advocate that there could potentially be a mandate upon physicians to remain in the system, remain in Medicare, remain in the Affordable Care Act in any sense, or link it to licensure or something like that?
I would never advocate making anybody do anything like that. I mean, I just think human nature, what right do I have to do that? Now, I hope in the legislation there are some incentives. That's what we should do. That's what we do the best in my opinion as a government, to make it more attractive, easier, streamlining paperwork, sometimes I'm amazed anybody does any work with Medicare. It is so onerous. The paperwork, the bureaucracy, the regulations that you have to go through. And I have to say that this is the best we could pass. It's not the best bill that one could ever write. Believe me, I know that. But this is the best we could put out at this time, and we felt it was critical to pass it when we could, and then begin to work on it. All right, Mimi, rescue me, right?